Welcome everyone to our eSeminar, which is around Pathway, which is a technological approach to cardiac rehabilitation. And so part of the presentation is about explaining Pathway, but also for those who are interested in the use of e-rehabilitation. For other conditions, you'll see how the use of technology could be brought into this platform and used for other conditions, other diseases, and also how other technologies could be brought in. But one thing I would like to make clear is that technology here is just a facilitator. It's not a driver of the design. What the driver of the design is understanding the condition and understanding behavioural change. And to me, what will be is apparent is that everyone knows they should exercise more. The real challenge is how to get them to do it. And that's behavioural change. And the technology is just a facilitator for this. So, with a little bit of background, is that cardiovascular disease accounts for 30 to 40% of premature deaths and has a significant effect on people's quality of life. From a financial perspective, it costs the European Union a huge 190 billion a year. So we have an ethical, most important, requirement to facilitate cardiac rehabilitation, but also there is a societal requirement here around costs. So what is cardiac rehabilitation? Well, there are 5 elements or 6 elements to cardiac rehabilitation, from managing alcohol, stress management, smoking cessation, diet, and remembering to take medications. We do include all of these in Pathway, but the main focus is around physical activity and exercise. And the reason for this is that it can reduce the likelihood of premature deaths by almost 25%. Now that is huge as an intervention. The challenge that we have, though, is that how many people make use of cardiac rehabilitation. So let's understand what cardiac rehabilitation encompasses. There's 3 phases to it. In the first phase, after perhaps Pauline comes in, presents with having had an event and has a stent put in, and the first phase of rehabilitation is hospital-based, and it's around early mobilization and education around the condition. Then, after a period of time, they will Pauline will ultimately leave hospital, but she'll return for between 6 and 12 weeks, depending on where you're based, 2 to 3 times a week, for a dedicated cardiac rehabilitation program with a cardiac rehabilitation team that focuses on exercise and education around the other lifestyle factors that I mentioned. Then after phase 2, the whole aim is that someone would go to phase 3, which is community-based cardiac rehabilitation. The challenge is that this isn't funded by governments, and so it's up to local enterprises to deliver this. And the challenge we have is that there's very few of these for people to go to, but they are extremely effective. So if we can understand what the barriers are to people attending phase 3, we need to come up with another solution for it. Because at the moment, only 10% of the people who are eligible for phase 3 actually attend phase 3 programs. And some of these subsequently drop out. So we've got less than 10% making use of a rehabilitation approach that will reduce the likelihood of premature death by 25%. So if we want to design a system to address this, we have to understand the barriers to this. So some of the barriers are, for example, that people have an inability to find programs appropriate for themselves. They can't just go along to the local gym and find a program that's dedicated for cardiovascular rehabilitation. And because there's very few programs, then we have issues of how far people have to travel to get to them. People have busy schedules. Many people with cardiac events return to work or are still primary caregivers in the home, and they can't fit into the schedule of those programs that are available. We also have to address the issue of people being isolated in their own home, that they need support to get through what is a very difficult time and requires a very big change in their lifestyle, because for many people the reason they've suffered a cardiac event is that they didn't have an appropriate exercise and lifestyle regime. And maybe finally people have an image that if they go along to a program, people will be able to do things that they can't do. So our approach or our solution to this is, instead of when someone leaves hospital in phase 2 into phase 3 community-based, they go to a home-based program, and that's what Pathway is. It's internet-enabled, sensor-based home exercise platform. And it's based around behavioural change that allows them to exercise in their own home and self-manage their own condition. So when we say it's an internet-enabled, basically what it is that the whole program, the whole system is delivered to them on the laptop. And via this laptop then, the whole system is connected with Pathway Central, where ordered data is stored, and it delivers everything that the patient needs in relation to the program, all the way from goal setting to feedback, and all of the components that I'll go through now. But it's an internet-based program, and it's delivered to them on the laptop. Now it's sensor-based, and we have a number of sensors, and the reason we have these sensors is simply to optimize the intervention for them and make it more likely that they will exercise. So, for example, we have the Microsoft Connect and we have the Microsoft Band. And just if you're not familiar with these technologies, basically we have the Microsoft Connect. So this is the avatar that you exercise along to. And if you were exercising now in front of the Microsoft Connect, it would see you, and this is what it represents as you. And we could make this really, really accurate, really facial detail of you, but patients didn't want that. They don't want to see themselves in detail. They want to see themselves as this image, so they know that they're doing the exercises correctly, but they don't want to see it in detail. At the same time, the Microsoft Connect does two things. It counts the repetitions, so we know whether the person's doing the exercise and we can give feedback to them. And we've developed algorithms that it can tell if you're doing the exercises well. And if you can't keep up with the exercises, that you're not doing them well enough, that we determine them as being too difficult for you, it automatically changes the exercise for the next time. Because people don't want to have a feeling of failure in doing the exercise, else they'll stop doing them. At the same time, the Microsoft Band measures the heart rate. So if someone's heart rate is too high for the optimum exercise from a health perspective here, is that it will change the exercise to reduce the intensity. And if the intensity is too low, it will change the exercise to increase the intensity, to get people into this target area, but safe. The other sensors we have is that we have a blood pressure monitor, so before they exercise, the blood pressure is taken to ensure that they're ready to exercise, and if need be, they can also wear a 3-lead ECG. Now, we've integrated it from a research perspective, and we're not using it to trigger if someone's having arrhythmias, for example, because the system is capable of doing it in simple movements, but we need to develop it to be able to do it while people are aggressively exercising. And apart from that, we use people's mobile phones so that we can deliver feedback to them, to encourage them to exercise, or if they've stopped exercising, to re-engage with the exercise.